Hi, I'm Dr. Yalo. Welcome to my YouTube channel. Today we are going to speak about the microvascular complications of diabetes. As we all know, diabetes is a condition where there is high blood sugar, which is as a result of the body either not making enough insulin, which is what happens in type 1 diabetes, or where the body is making insulin but is not working properly, where the body has developed resistance to insulin. So which is what typically happens in type 2 diabetes. So today we are going to speak about the complications that are resulting from diabetes. So microvascular complications normally refers to complications affecting small blood vessels and nerves. So the three systems that are normally involved, we are talking about the eyes, which is what we call retinopathy, the kidneys, which is what we call nephropathy, and nerves, which is what we call neuropathy. So retinopathy normally refers to damage of your retina. The retina is at the back of your eyes. And that is what creates an image that is normally transmitted to your brain to be able to tell the brain exactly what you are seeing, so the brain can interpret it for you. So the inflammation that results from high blood sugar normally causes some bleeding and what we call cotton wool spots, and then also growth of abnormal blood vessels on the retina, and this affects your vision. So how we pick up retinopathy is for most people that are having proper diabetic clinics or diabetic follow-ups, you'll find that you will have at least once a year where they are checking your eyes to look at the retina and see if they can pick up those abnormalities. So when they pick them up, some of them require intervention, and some would normally require an eye specialist depending on the severity of the damage. When it comes to kidneys, the kidneys normally, their job is to filter the blood of any waste products and also anything that is in excess. So that includes water, minerals, and anything else that needs to be filtered, like medications. The kidneys normally also filter that. So you need a good functioning kidney to be able to survive. Because if these waste products start building up when the kidneys are not filtering them properly, they can result in some fatal complications. So the kidneys, the blood vessels in the kidneys can also be damaged by the sugar, and that now results in the kidneys not doing their job properly. We would normally, most of the time, the kidneys does not really show clear symptoms that we can pick up. However, if you are going for, let's say, an annual checkup for as a diabetic, then the doctor or the nurse will normally do a blood test that can be used to estimate how well the kidneys are doing the filtration, and then they can also do a urine test that shows how the if the body is, the kidneys are allowing some proteins to go through, because under normal circumstances the kidneys will normally filter out the excess products, but they would normally keep the proteins in the blood. So if we start picking up a high amount of protein leaving the bloodstream through the urine, then we know the kidneys are damaged. And we normally use those two to guide us as to whether there is kidney damage, and if there is kidney damage, how bad it is, so we know how to intervene. So the final stage of kidney damage, what we call end stage kidney failure, is normally where people end up needing to have kidney transplants or being put on dialysis, where there is a machine that actually does the filtration for the body. All of this can really badly impact your health and can possibly result in death. In fact, death resulting from kidney failure is one of the common causes of death in diabetics. Then when it comes to neuropathy, your nerves, you have different nerves. You have what we call peripheral nerves, which are the nerves that give you sensation in your peripheries, so that now your arms, your legs, and then you have the nerves that normally help you to communicate information from the brain, let's say to your heart, to your bladder, to your even your genitals. And all of this can be damaged by the sugar. So that can result in, let's say if your peripheral nerves are damaged, you can start either feeling numbness, or you start feeling abnormal sensations like tingling, or you start feeling pain, or normal sensations start feeling painful, like let's say touch starts feeling painful. Then you can have nerves going to your sexual organs, for instance, can result in sexual dysfunction. So erectile dysfunction in men, but also in women, you might find that the loss of sensation can result in decreased libido, and that can also result in inability to achieve an orgasm. And for men, usually you find that the decreased sensation because of the damage in the nerves can also result in erectile dysfunction. Then you have your bladder. If your nerves to your bladder are damaged, you'll find that you might struggle to urinate. So your bladder feels full, but you are not able to urinate, or where you lose control of the bladder. Then you can have a problem with your stomach. Normally, when you eat, the food passes through the stomach into your intestines smoothly within 4 hours. But you might find that when the nerves of the stomach are damaged, the food sits longer in the stomach, making it difficult for the food to move down, and then that can result in nausea and vomiting and abdominal discomfort, and then it makes it difficult for the food to be processed adequately. Then you can also lose your ability to control your blood sugar, or to control your blood pressure. So some people can start having fainting episodes, where the blood pressure is dropping too low, or where you have people struggling to be aware of when their blood sugar drops. So what we call hypoglycemia unawareness. So normally when your sugar drops, you can feel it. You start shaking, you start feeling dizzy, and you are able to then intervene. But then if your nerves are damaged, you might find that you struggle to be able to sense that, and that can be quite dangerous. All of these conditions normally can be prevented by making sure that there is good blood sugar control, and then all the other factors that are involved in resulting in these conditions, it's also important to control them. That includes controlling blood pressure, controlling if you're having high cholesterol, making sure that your cholesterol is controlled, making sure that you are exercising to make sure that you are having good blood flow to all these organs. And then an appropriate diet that is not putting the blood sugar too high, but is also supplying the body with all the necessary nutrients, vitamins, minerals, and water that is necessary for the body to function normally. Avoiding alcohol, especially when it comes to anything, any damage to the nerves. Alcohol can also damage your nerves. To cut down on smoking and actually stop smoking, because smoking also damages your blood vessels and can cause all these complications that we just mentioned. So at least when you are away, then it just should encourage you, or if you are diabetic, or if you know someone who's diabetic, to make sure that they turn up for their follow-ups, that they are taking their treatment, and that they get supported in making sure that they live a healthy lifestyle to be able to avoid these complications. Thank you for joining me. Check down in the links below. There are some extra resources that you can refer to if you want to know more about these conditions. And I will see you in the next video.